Meet Craig Flinders, D.O., with Riverview Family Clinic. While Craig always knew he wanted to be a doctor, the opportunity to build long-term relationships led him to become a family practitioner.
When I originally applied to medical school, I thought I was going to do anesthesia. And then I thought I was going to do interventional radiology. And as I got out on some rotations, I decided being able to talk to patients was important. And in radiology, you don't have as much patient contact. And in anesthesia, you see them and knock them out, so then you're not talking to them as much either. Then I thought about emergency medicine, but the difficulty I had with that is I never got the follow-through or follow-up on whatever happened with the patient, and you don't really get to know a patient as well, so that's where family medicine came in, so that I can take care of families. I can know mom, dad, and their children and be able to help them with their healthcare needs.
What makes you feel you're making a difference?
There has been some miraculous thing that we've uncovered something that has taken a long while, or a patient has gone to multiple different tests or providers or something like that. Or it could be something even as simple as we sat down and talked and maybe even had some discussion on non-medical related things, and we're able to just kind of bond together and feel like that it was a complete whole experience rather than just a small fragmented experience.
Why is it important for you to get to know your patients?
If we have a relationship with someone and we know what's going on, when we start seeing things that are a little different or a change, the signals are going off that we need to investigate a little further. And if you don't have that relationship, it's harder to pick those out because you just don't immediately know.
What's your approach to practicing family medicine?
What I recommend when patients come to see me is that they bring their medications. It is amazing the number of people that have no idea what medications that they're on. Another thing that's probably a little unique to me, I tend to order tests or even talk to a patient before they come in to find out why they're coming in, so that any particular test or x-ray is done so that when they do come in, we can discuss it. So we can go right to the meat and potatoes.
What are the benefits of having a clinic in Nekoosa and hospital in Wisconsin Rapids?
Certainly an advantage to a patient coming into our system is support of the local community and kind of a family-centered approach to care. Though we may need to refer some people out to outlying specialties, there's a lot that we can do here in our own hometown community, and oftentimes patients are surprised at the amount of resources that we have available at the hospital or even here at our clinic.
On a more personal note, you achieved the status of Eagle Scout, which is a great honor. How important was it that you earned that status, and how do you motivate others on that path?
When we have these kids that are working on their scouting activities and they are like that close to Eagle, I always tell them, you know, one reason why I'm here is because I'm an Eagle Scout. I've always mentioned that. That means a lot to people. The general public knows that an Eagle Scout is a high honor and that it takes a lot of work to do that. But I also tell them that, you know, being this close to an Eagle Scout, you will either live the rest of your life in regret, knowing that you didn't put forth the extra effort to make it, or you'll live the rest of your life knowing that you put forth the extra effort and you'll never regret that decision.
Dr. Craig Flinders.